and gentlemen, I am Lisa Danley, and I'm a nurse practitioner student here at Auburn University, and I come to you live tonight on Campus News to tell you about the role of the nurse practitioner. What is a nurse practitioner? A nurse practitioner is an advanced practice nurse trained to assess patient needs, order and interpret diagnostic and lab tests, diagnose disease and illnesses, prescribe medications, and create treatment plans. People may ask, what is the role of the nurse practitioner? They can provide expert nursing care to patients with a medical approach. They assess, diagnose, and treat patients in a variety of healthcare settings. Nurse practitioners can manage their own patients independently as well as follow up alongside of a collaborating physician. They also provide quality care to millions of American people and are the providers of choice. Here are some facts about nurse practitioners that you may not have known. According to the AANP, nurse practitioners have been providing care for almost a half a century. There is a growing need for health care with an increase in the population and aging baby boomers and the Affordable Health Care Act, leading to more insured individuals having the ability to seek care. In 2012, more than 80% of nurse practitioners are prepared in primary care, which is more than physicians and physician assistants. An estimated 70% of NPs see 3 or more patients per hour. The number of nurse practitioners are increasing yearly, with an expected estimate of 244,000 by the year 2025. There are requirements to be met to be able to serve and practice as a nurse practitioner. First, they must receive a bachelor's degree in nursing. The next step is for licensure as a registered nurse. Then they must receive a nursing education at the graduate level, and then after they receive this education, they must sit before a national board certification. There's 2 different certification boards that they can sit before, either the American Nurses Credentialing Center or the American Association of Nurse Practitioners. And then the last step is to receive a license and registration in the state in which they wish to practice. Most nurse practitioners are educated with a master's degree, but there is a shift taking place towards them receiving a doctorate degree. The National Organization of Nurse Practitioner Faculties set program standards and guidelines. They also establish a set of core competencies as recommendations for curriculum content to include scientific foundation, leadership, quality, practice inquiry, technology and information literacy, policy, health delivery systems, ethics, and independent practice. In the core curriculum of advanced practice nurses programs, there are 3 core classes. The first class is advanced pathophysiology, which entails the general principles of diseases across all lifespans. The second class is advanced pharmacology, which educates students on the categories of drugs, including pharmacodynamics, pharmacotherapeutics, and pharmacokinetics. And the last core class is advanced health assessment to teach students assessment techniques, assessment skills of the systems and concepts, and approaches to disease processes. Nurse practitioners are educated utilizing the medical nursing model. They receive a minimum of 6 years of schooling to obtain a graduate degree, and then they also receive 700 to 800 clinical hours during the degree track. NP's scope of practice is determined by the state in which they practice. Core duties performed are determined at the state level. NP's scope of practice in Alabama is regulated by the Alabama Board of Nursing. CRNPs are allowed to work in a practice setting with a collaborating physician in their scope of practice as long as they align. Procedures and functions must be qualification-based on formal education, clinical training, and area of certification received. Core skills include arranging for admissions of inpatients, transfers and discharges, rounds and progress notes, completion of forms pertaining to medical records, health histories, record review, ordering of labs, diagnostic procedures, and x-rays. They're allowed to form medical and nursing diagnosis and implement therapy and referrals as needed. Authority to prescribe legend drugs, medical devices, nutrition, and supportive services are also allowed. scope of practice in Alabama also includes the authority to analyze and interpret lab and diagnostic results, local anesthetic administration, arterial lines, bimanual pelvic exams, biopsies, bone marrow aspirations, cardiac stress testing, cast application and removal, and chest tube removal. It also allows for working with the physician in a team relationship, but on-site presence is not required. Nurse practitioners have the ability to function in a variety of practice settings. These practice settings include pediatrics, women's health, private practice offices, nursing homes, as well as ambulatory care centers. They can also work in rehabilitation centers, home care, as well as many specialty clinics to include surgery, nephrology, and urology. The role of the nurse practitioner is continuously evolving. The scope of practice and regulations can be impacted by the growing need for healthcare providers. Rural areas lacking physicians can push states to broaden the scope of practice, allowing more freedom in providing the care needed for that area. Greater independence can allow for the delivery of safe and timely care delivery as well. Many people may ask, why use a nurse practitioner? Nurse practitioners deliver quality health care with the skills and training of a nurse. NPs bring more depth to the healthcare provider profession by utilizing nursing skills and applying the advanced medical knowledge gained and applying it to treating the patients, as well as delivering affordable, cost-effective health care.